Treatment. Back pain usually resolves with rest and home remedies, but sometimes medical treatment is necessary. Home treatments. Over-the-counter (OTC) pain relief medication, usually nonsteroidal anti-inflammatory drugs (NSAID), such as ibuprofen, can relieve discomfort. Applying a hot compress or an ice pack to the painful area may also reduce pain. Resting from strenuous activity can help, but moving around will ease stiffness, reduce pain, and prevent muscles from weakening. Medical treatment. If home treatments do not relieve back pain, a doctor may recommend the following medication, physical therapy, or both. Medication. Back pain that does not respond well to OTC painkillers may require a prescription NSAID. Codeine or hydrocodone, which are narcotics, may be prescribed for short periods. These require close monitoring by the doctor. In some cases, muscle relaxants may be used. Antidepressants, such as amitriptyline, may be prescribed, but research is ongoing as to their effectiveness, and the evidence is conflicting. Physical therapy, applying heat, ice, ultrasound, and electrical stimulation, as well as some muscle release techniques to the back muscles and soft tissues, may help alleviate pain. As the pain improves, the physical therapist may introduce some flexibility and strength exercises for the back and abdominal muscles. Techniques for improving posture may also help. The patient will be encouraged to practice the techniques regularly, even after the pain has gone, to prevent back pain recurrence. Cortisone injections. If other options are not effective, these may be injected into the epidural space, around the spinal cord. Cortisone is an anti-inflammatory drug. It helps reduce inflammation around the nerve roots. Injections may also be used to numb areas thought to be causing the pain. Botox, botulism toxin, according to some early studies, are thought to reduce pain by paralyzing sprained muscles in spasm. These injections are effective for about 3 to 4 months. Traction pulleys and weights are used to stretch the back. This may result in a herniated disc moving back into position. It can also relieve pain, but only while traction is applied. Cognitive behavioral therapy (CBT) can help manage chronic back pain by encouraging new ways of thinking. It may include relaxation techniques and ways of maintaining a positive attitude. Studies have found that patients with CBT tend to become more active and do exercise, resulting in a lower risk of back pain recurrence. Complementary therapies. Complementary therapies may be used alongside conventional therapies or on their own. Chiropractic, osteopathy, shiatsu, and acupuncture may help relieve back pain, as well as encouraging the patient to feel relaxed. An osteopath specializes in treating the skeleton and muscles. A chiropractor treats joint, muscle and bone problems. The main focus is the spine. Shiatsu, also known as finger pressure therapy, is a type of massage where pressure is applied along energy lines in the body. The shiatsu therapist applies pressure with the fingers, thumbs and elbows. Acupuncture originates from China. It consists of inserting fine needles in specific points in the body. Acupuncture can help the body release its natural painkillers, endorphins, as well as stimulating nerve and muscle tissue. Yoga involves specific poses, movements, and breathing exercises. Some may help strengthen the back muscles and improve posture. Care must be taken that exercises do not make back pain worse. Studies on complementary therapies have given mixed results. Some people have experienced significant benefit, while others have not. It is important, when considering alternative therapies, to use a well-qualified and registered therapist. Transcutaneous electrical nerve stimulation (TENS) is a popular therapy for patients with chronic back pain. The TENS machine delivers small electric pulses into the body through electrodes that are placed on the skin. Experts believe TENS encourages the body to produce endorphins and may block pain signals returning to the brain. Studies on TENS have provided mixed results. Some revealed no benefits, while others indicated that it could be helpful for some people. A TENS machine should be used under the direction of a doctor or health professional. It should not be used by someone who is pregnant, has a history of epilepsy, has a pacemaker, has a history of heart disease. TENS is considered safe, non-invasive, inexpensive, and patient-friendly, and it appears to reduce pain, but more evidence is needed to confirm its effectiveness in improving activity levels. TENS machines and other pain relief methods can be purchased online. Surgery. Surgery for back pain is very rare. If a patient has a herniated disc, surgery may be an option, especially if there is persistent pain and nerve compression which can lead to muscle weakness. Examples of surgical procedures include fusion. Two vertebrae are joined together, with a bone graft inserted between them. The vertebrae are splinted together with metal plates, screws or cages. There is a significantly greater risk for arthritis to subsequently develop in the adjoining vertebrae. Artificial disc. An artificial disc is inserted, it replaces the cushion between two vertebrae. Discectomy. A portion of a disc may be removed if it is irritating or pressing against a nerve. Partially removing a vertebra. A small section of a vertebra may be removed if it is pinching the spinal cord or nerves. Injecting cells to regenerate spine discs. Scientists from Duke University, North Carolina, developed new biomaterials that can deliver a booster shot of reparative cells to the nucleus pulposus, effectively eliminating pain caused by degenerative disc disease. Prevention. Steps to lower the risk of developing back pain consist mainly of addressing some of the risk factors. Exercise. Regular exercise helps build strength and control body weight. Guided, low-impact aerobic activities can boost heart health without straining or jerking the back. Before starting any exercise program, talk to a healthcare professional. There are two main types of exercise that people can do to reduce the risk of back pain. Core strengthening exercises work the abdominal and back muscles, helping to strengthen muscles that protect the back. Flexibility training aims at improving core flexibility, including the spine, hips, and upper legs. Diet. Make sure your diet includes enough calcium and vitamin D, as these are needed for bone health. A healthful diet also helps control body weight. Smoking. A significantly higher percentage of smokers have back pain incidences compared to non-smokers of the same age, height, and weight. Body weight. The weight people carry and where they carry it affects the risk of developing back pain. The difference in back pain risk between obese and normal weight individuals is considerable. People who carry their weight in the abdominal area versus the buttocks and hip area are also at greater risk. Posture. When standing, make sure you have a neutral pelvic position. Stand upright, head facing forward, back straight, and balance your weight evenly on both feet. Keep your legs straight and your head in line with your spine. Posture. When sitting, a good seat for working should have good back support, arm rests and a swivel base. When sitting, try to keep your knees and hips level and keep your feet flat on the floor, or use a footstool. You should ideally be able to sit upright with support in the small of your back. If you are using a keyboard, make sure your elbows are at right angles and that your forearms are horizontal. Lifting. When lifting things, use your legs to do the lifting, rather than your back. Keep your back as straight as you can, keeping your feet apart with one leg slightly forward so you can maintain balance. Bend only at the knees, hold the weight close to your body, and straighten the legs while changing the position of your back as little as possible.